Hi, I'm Kathy Orcito, the President and CEO of St. Joseph's Hospital Health Center, and wanted to take a moment to reflect on everything that we've accomplished in 2011. It's been quite a year for our organization. We've seen more patients than ever before, we've provided the highest quality of care, and we've really worked to position ourselves for healthcare reform. It's because of our employees, our people, that we were able to accomplish everything that we set out to accomplish in 2011. We wanted to take a moment to celebrate those accomplishments in this video, and I think you'll agree with me, it's been quite a year.
In support of our strategic goal for people, we continue to recruit the best and the brightest to St. Joseph's. Our Human Resources team added a new feature to the Career Opportunities website, Live Chat with recruiters. We increased volunteer hours from 5 to nearly 40% in some areas of our system. Plus, we continued to recognize our employees. St. Joseph's joined the Daisy Foundation, a national program that rewards and celebrates clinical skill and compassionate care of nurses. A new pharmacy postgraduate residency program and graduate nurse internship program provided new opportunities for clinicians to further develop valuable skills. And our mission education sessions reached more than 4,000 employees and staff. We all know and live our mission. We are passionate healers dedicated to honoring the sacred in our sisters and brothers. Our talented staff of physicians has also had a successful year. Here's Dr. Fetterman to share more about that.
In support of our strategic goal for physician relationships, we've continued to integrate our medical staff into the St. Joseph's system. We appointed Fred Letourneau Vice President for Physician Enterprise, a new position. He is helping to form an integrated system of care made up of employed and private physicians. We also grew our emergency department staff. We now have a fully staffed ED in terms of physicians for the first time in many years. Our physicians continue to go digital. They began using SJ Orders, which is a new computerized physician order entry system. Many more signed on to the Regional Health Information Organization, a secure electronic health information exchange that gives authorized medical providers access to essential patient information. Physicians continued to participate in many quality improvement initiatives, including our pilot antibiotic stewardship program that is seeking to help physicians make judicious decisions on the use of antibiotics. We are proud of our physicians who continue to earn accolades from their peers and beyond. Dr. Seth Grenke, orthopedic surgeon, received the Dr. Peace Award. Dr. Juno Lee, radiologist, received the Medical Imaging Staff Appreciation Award. And Dr. Bobby Pohar won the Sister Patricia Ann Award. Dozens more of our physicians were named to the Best Doctors list within our region. The medical staff wouldn't be successful without the help of a talented clinical and support staff. Here to share more on the clinical and service accomplishments is Carol Murnane.
We have many accomplishments in support of our strategic goal for clinical and service excellence. We completed a successful DNV accreditation survey, and our College of Nursing completed a Middle States accreditation for 2011. We implemented a hand hygiene program to increase rates among staff. Our infection control team had a blast making music videos to help us remember to wash our hands.
Stop and wash your hands before you go in there.
We also hosted a community meeting to lead the healthcare community in the fight against C. diff. Hospital-acquired condition reduction, or HACR teams, developed and implemented strategies to significantly reduce HACs throughout the hospital. Initiatives saved more than $500,000. In surgical services, an aviation-based patient safety training program called LifeWings is helping improve quality. The surgical service team also now participates in a surgical quality database. We also implemented a new safety program to reduce the incidence of patient falls. St. Joseph's continues to lead the way in the use of new technologies, including a trial in the cath lab to test the safety and effectiveness of robotic-assisted coronary angioplasty. We were one of only 8 hospitals in the world evaluating the new system. We entered into an IV pump management program with Universal Health Services, and information management enhanced the wireless network to provide full coverage for data, voice, and real-time location tracking. In addition to new technologies, we continue to work on new approaches to care. Clinical educators and a primary nursing team developed and executed an education program to aid in the implementation of primary nursing. To help support our clinical staff, a peer diffusing program was designed to provide early recognition and support of stressful events. We continue to support our patients too. The Seeds of Hope Grief Support Program in the Surgical Intensive Care Unit was established to provide comfort to families experiencing loss. Anti-dialysis Services established a patient advisory board to help bring forth concerns. Our clinical and service excellence led to financial success. Here to tell us more is Tom Baxter.
In support of our financial success, our foundation team raised millions to help our expansion project as well as our programs and services. As always, our two signature fundraising events were extremely successful. The Golf Classic netted more than $227,000 and our gala netted nearly $350,000. The foundation in total raised nearly $2.2 million for programs and services. In fact, the team secured the second largest single contribution from a living individual in St. Joseph's history. The Generations Capital campaign to fund the new expansion raised nearly $8 million in 2011, bringing the campaign total to $15 million. That total includes $3.5 million in government grants. Again, 2011 was a record-breaking year. The Generations campaign secured the largest single contribution from an individual in St. Joe's history. The gift names part of the expansion the Ralph and Christina Nappy Emergency Services building. St. Joseph's also worked to be more efficient throughout the system, successfully reducing length of stay for surgical patients and reducing the daily alternate level of care census. An automated television ordering system also was developed, which is expected to generate more revenue for the service. With financial success comes growth. Here to tell us more about how we grew in 2011 is John Flask.
St. Joseph's continues to grow by leaps and bounds. In some ways, that development is visual, in the form of a new emergency services building. In other ways, we grew behind the scenes. We established and executed a new social media strategy using Facebook and Twitter, as well as blogging. In addition to expanding its digital footprint, St. Joseph's also added more physical space. The Center for Wound Care and Hyperbaric Medicine added 1,500 square feet of space at Northeast Medical Center to improve flow and accommodate the growing need for that service. At the hospital, a new $6 million kitchen opened, launching on-demand room service for all patients. The emergency services building neared completion and is scheduled to open in 2012. The facility will include an expanded emergency department, observation unit, green data center, and psychiatric emergency room. CPEP improved overall access to medical emergency services by reducing its diversion by 20% in 2011. CPEP also increased its mobile crisis outreach visits by 44% without creating additional expense. Mental health services further expanded its neighborhood programs as well. We maintained or increased our market share in many of our service lines. For example, surgical volume went up by nearly 800 procedures. To assist with patient flow, we added weekend hours for some of our support services. Speaking of support services, we successfully recruited 14 IT professionals to help support our strategic investment in information technology. Some of the initiatives they'll work on include the continued move to computerized provider order entry and electronic medical record. Our Franciscan companies also helped support our system's growth in 2011. Here to tell us more about that is respiratory therapist Mary Jane Luke.
Franciscan Companies started 3 new business ventures in 2011. A state-of-the-art expanded Oneida Sleep Laboratory, a preferred provider agreement with Auburn Memorial Hospital, known as Auburn Health Support Services, and Embracing Age, a membership-based concierge service for seniors. A new sales force resulted in a sharp increase in new referrals, and Franciscan Health Support, a licensed home care agency, grew its census by 29%. St. Elizabeth's Health Support experienced a 126% increase in net income and was reaccredited by Joint Commission. Franciscan Companies met its financial goal of $400,000 in sponsorship to St. Joseph's, and it also sponsored many community events, including St. Joseph's Gala and golf events, and the Sisters of St. Francis Fairway to Heaven golf tournament. St. Joseph's Home Care and Hospital Home Health Care was cited by Outcome Concept Systems as one of the top 500 performing home care providers in the United States. St. Joseph's received many more accolades in 2011. See for yourself.
Well, I think you'll agree it's been a terrific year for St. Joseph's. Our staff, our physicians, our trustees, our patients have all contributed to make it one of the best years ever. On behalf of everyone at St. Joseph's, thank you for your contributions, and we're looking forward to meeting the challenges of 2012.